Hi, this is Dr. Pranav. Today in this video, I am going to touch one of the controversial topics, treatment charges, the price war in dentistry. As a dentist, most of us are part of lots of dental groups on WhatsApp and Facebook. And these days, it's common to see heated discussions over treatment charges in such groups. In fact, few months back, you must have come across the viral telephonic conversation between two dentists debating over the treatment charges. And there is one thing you might have noticed, that this kind of discussions lead nowhere. The only thing it does is degrade the profession. If you really care about dentistry and your profession, then do watch this video till end. So first things first, let's understand the root cause of the price war. We did a survey on our website dentistry.com and asked young dentists about where they would like to set up their practice. The survey revealed that more than 80% of young dentists wish to set up their practice in either metros or tier 2 cities, which are already full of dental clinics. Also, most of these new practitioners wish to quickly establish their practices, and they think that they will overcome the competition by lowering the treatment charges. And this is where the price war begins. Many young dentists think that their initial step of keeping the treatment charges low will help them to establish themselves, and profitability can be brought later. But this is where they go wrong. They are unaware of the fact that any efforts to revise the charges at later stage are met with a lot of resistance. Now let's talk about the senior practitioners who are already established. Initially, when new dental clinics open up around their practices, no one bothers. But as the number of such new dental clinics increase, the senior dentists also start facing resistance by the patients. In fear of losing patients, many of them do not revise their charges, and the price war continues to degrade the profession. Now let's see who is getting affected. Anyone who is underpaid will obviously look for ways to cut down on the expenses. And that's why some dentists use substandard materials and equipment. You can't deny that there are dentists who don't even follow the basic sterilization norms just for the sake of cost cutting. When you sell yourself cheap, you can't invest in newer technology, gadgets and materials. You can't invest in learning new skills, which eventually makes your knowledge obsolete. And ultimately, the one who suffers is the patient. So what's the solution? Every human being deserves quality healthcare services, and that's why we have charitable or government hospitals. If you have a non-profit practice working for the betterment of society, then we are really proud of you. You are a hero. But in case if you're offering treatments at cheap cost just to overcome the competition and compromising in the quality of treatment, then I think it's nothing but a crime. As a doctor, we need to understand that lowering treatment charges is not the way to overcome the competition. There are better ways to have competition-proof practice. If you want to know how, then visit my YouTube channel and check out the ABCD rule of competition-proof practice. Thank you.